So if I remember right, you came in here with leakage of urine which you could not control.
Yeah.
And were you wearing diapers?
Yes.
For how long?
Diapers since last November. Still, almost, yeah.
Almost an
1
year
year.
kind of thing. You're wearing diapers. Then you would leak urine while walking, running,
Walking,
jumping.
running, continuous. Where I could not walk 1 or 2 steps also.
So you were on the younger side in 40s and you could not control urine, but you also would leak urine at odd times, odd locations with minimal amount of stress.
Yes.
That was stress incontinence.
Yeah.
You landed up here. Before that, you had seen some doctors around, and we're not naming them around, but you're attempting your best, isn't it?
Yeah.
You're also aware that the knowledge of this subject in society is so minimal. The subject is stress incontinence, not the mental stress, but the stress that you and I would give to our body when we strain, when we jump, run, laugh, cough, etc., etc. That's what you're going through, isn't it? So, in this last year of wearing diapers, how are you managing yourself?
It was pretty means like us to go through a very tough time because I used to be into yoga, walking, dancing. Every time, daily 3 or 4 diapers I had need to change. But now I'm like a easy, like no diaper, no pad. Just I can walk in.
Thank you. So you came to the stress incontinence clinic at the Kokilaben Hospital in Department of Urology.
Yeah.
Were you confident that I could get your diapers out? I could treat you? Were you confident enough?
Yes, I
You-
was confident.
You're confident. So you knew.
Feedback I got from my uncle regarding you, so I was confident.
So you felt confident. You came in here. I gave you the vision of a possibility of at this age and beyond, be out of diapers, which is 3-4 diapers for last 1 year. Were you good enough 1 year ago, or there was something happening 1 year ago also?
No, this I'm suffering from last 7 to 8 years.
So 7 to 8 years
Sanitary pad.
wearing sanitary pads. Then you came to diapers, which were multiple a day.
Yeah.
And sadly, you're going through. So 7 to 8 years of stress incontinence, which was managed by diapers,
Yeah.
which were managed by sanitary pads,
Yeah.
worsened, and then you had to wear diapers.
Yeah.
And diapers for a year, and you kept on attempting your treatment with doctors.
Yes.
So women will go to women gynecologists and will attempt treatment. Women may go to urologists, to family practitioner. You live in a maximum city where you do all that. I'm not sure how was your family coping with it. So sorry to rope you in, but what was happening with you and the entire family?
Absolutely. To add here, in addition to what she spoke, really I want to add that possibly for the last more than 7 years, in fact, she was going through this kind of challenges that with the urine incontinency. We have met many doctors, and the doctors really couldn't. They were absolutely. We had a lot of tests, urodynamics, whatever, all sorts of tests we had. But none of the doctor was directing us, or they were very confident saying that yes, this can be curable, because they said that you may have to go through surgery. Some said that you can cure it through medicines. So we never had the confidence that which doctor can really. It's not I'm blaming the doctor community, because when we speak to the doctors, we need to have a kind of confidence within ourselves that yes, we can have a trust in this doctor. But we couldn't get that in the last 8-7 years of our search. Then your name was referred. Thankfully, we are very thankful for that. We are very grateful for that. What we understood is that the day we landed up here, the way we stepped into your cabin, you said that you, without discussing, oh, this is your challenge. You don't worry, I will fix it. So we had so much of confidence in your capability. We saw all these things, and wonderful to talk about. Indeed, I need to say that within a month's time, everything changed, and now I think she's completely cured. She's wonderful. I was checking a week on week what is the progress happening. We are absolutely thankful to you, Doctor.
So good to hear the confidence that you had.
Yeah.
Good to hear the confidence you have, the medical community across. Stress incontinence is a women's phenomena.
Absolutely.
It doesn't happen in men. It may not happen to you and me, touch wood. But women sadly go through it as it progresses gradually with menopausal, with post-childbirth. Many a times post-childbirth, the pelvis doesn't recoil, and we may not be doing those exercises to strengthen the pelvis. Age-related hormone changes which happen in our mothers and grandmothers happen it. But she's so young, and a lot of young women suffer. I don't know where to go to. And that is where the challenge comes in around how to sort them out, how to convince and clear them out. So it's not about only treatment, it's about a cure.
Absolutely.
You got a cure from where you don't want to look back. So those years that you lost in perhaps in a quality of life disease, where you restrained yourself from so-called dancing and jumping and running and socializing and traveling, I'm sure was on a very lesser side.
Exactly, that's what we want to tell you, that whenever we used to travel abroad, we have to carry more than our baggage. It is more diapers we have to
Diapers
really
or my
carry,
sanitary
because we have
pads.
to ensure that she's been equipped with enough diaper to cover our tour. And so it's always like she has to even carry in her handbag. Whichever washroom she has to go, she has to keep changing that. So it was absolutely, I know the pain what she has gone through, but at the same time, we need to also balance our lives. So that's how.
So that's the empathy you had. I wish and pray all partners or all husbands and all brothers and sisters and fathers have that empathy towards, because we are guilty as doctors not asking a woman in her prime of life, do you leak urine? When you ask, she will say, why are you asking me this question? I've been leaking urine for time immemorial. 7 to 8 years of her life, she has gone through what she doesn't want to remember anymore.
Absolutely.
So, unfortunately, women have this problem. They need to leave incontinence, and live without incontinence is what we continue preaching at Kokilaben Hospital in the Department of Urology, creating a stress incontinence clinic. We look forward to more and more women getting enthused with us. Women go through this problem, they're not able to speak up, they don't know whom to go to. They would love to go to a gynecologist. A gynecologist in this country is very busy. A urinary job may not be always be a part of a gynecologist domain. A urologist's job is to take care of the urinary issue for men, women, child, geriatric, everybody.